Mixed in with the anxiety and the shifting norms that this pandemic has created are so many questions about how to stay safe and healthy. And to help answer some of them, we're turning to a team of doctors every night with your questions. And tonight, let's bring in Dr. Lenora Saxinger again, an infectious disease specialist with the University of Alberta, and Dr. Michael Curry, an emergency room doctor from Delta Hospital, that's just outside Vancouver, here in British Columbia. And Dr. Curry, let's start with you. At what point of feeling ill should someone decide that it's time to go to a hospital?
So with the COVID-19 pandemic, we're expecting a lot of visits and a lot of business in our hospitals. So unless you're feeling substantially ill, we're advising you to treat respiratory symptoms as though they could be COVID and to stay home. Reasons to come to the hospital would be shortness of breath, so feeling like you've run a marathon and all you're doing is sitting on your couch, or a chest pain or chest discomfort. If it feels like a respiratory infection that you've had before, then I would try to stay at home and self-treat. But problems breathing are probably the hallmark that you could have a more severe case.
All right, Dr. Saxinger, for a frontline worker like a grocery store clerk or a bus driver, there are questions about how they can keep their family safe when they come home from work.
Right. So people who are going to be interacting with the public a lot more have to do the same core things that we're recommending, but with a lot more attention and intensity. So frequent hand washing, at least every hour, if not more often. Wiping down high-touch surfaces that people come into contact, that you come into contact with, frequently with an appropriate household disinfectant or a bleach solution. And this is getting into an excess of caution, but is a consideration potentially. I know some people are choosing to change clothes so that the clothes that they wore out and about are not the clothes that they come into the house with, and that they put those clothes directly into the wash. I think that some of these recommendations can change as we know more, but an excess of caution seems reasonable, and we do want to keep people safe.
All right, Dr. Curry, let's move on to the next question now. And what are the risks to pregnant women and the fetus and women who have conceived during this time?
So our understanding is that it appears from very preliminary research that the virus does not pass from pregnant women to their fetuses. So that's good news. In terms of pregnant women, we do know that the immune system during pregnancy tunes itself down. And so that may make pregnant women a little bit more vulnerable to an infection like this. Fortunately, pregnant women do tend to be younger, and there's data supporting that women seem to be a little bit less affected by this than men. So women should follow the same advice as for everyone else, but perhaps be a little bit more mindful of social distancing and self-isolating until the frequency and the amount of this virus in the community diminishes.
Dr. Saxinger, we're getting a lot of questions about pets and in this time of the pandemic. And here's one of them. Can I let others pet my dog if I'm on a walk?
This question is really about whether or not someone who has virus on their hands can transmit it to your pet, and then you pick it up when you pet your pet. This seems to be a pretty remote possibility. Things like fabric or more porous materials sometimes are not as good at transmitting virus because the virus doesn't come off the surface as easily. But I think in terms of general precautions, and because whenever people get close to dogs and they both have dogs, everyone gets all tangled up, it might just be best to maintain the physical distancing for your pet as well as yourself. But if someone does pet your pet, I don't think you have to panic. Everyone should wash their hands before they come in, when they come in the house, though.
We have about a minute left. That'll go pretty quickly, but I want to finish by asking each of you this, starting with you, Dr. Curry. A lot of anxiety out there on the part of a lot of people. What's your message to people who are watching this feeling a little nervous tonight?
So for most people, this is going to be a fairly mild illness. So the impacts of this virus can be mitigated by social isolating and following the advice of public health. Life is going on, but we are going to face some challenges in the short term.
And Dr. Saxinger, last word to you.
I think that it's a very strange calm before the storm time right now, and people are tending to get very focused on details and worried about them. I'd say what we should direct our attention to is doing the things we know we need to do, and focusing on how to keep our social cohesion and our spirits up as we start going into this unknown together. And so don't panic, be resolute.
As always, I know both of you, all of our experts, are so busy, and we really appreciate your time tonight.
Thank you, Ian.
As we've mentioned, we'll be asking your questions about COVID-19 each night on The National going forward, so keep sending us the questions you have. You can message us directly on Instagram at CBC The National, or you can send us an email at thenational@cbc.ca.